I talked about the safety profile of blinatumomab, so the BiTE drug, monoclonal antibody directed against CD3 and CD19. The drug attaches CD3 positive T cells to CD19 positive leukemia cells, and the T cells are activated and they destroy leukemia cells. With this activation of the T cells, they expand in the body, and this is frequently related to an inflammation syndrome, which is called cytokine release syndrome. Patients get fever, they may have circulation problems, they may have even respiratory problems, and there are elevated parameters in the blood that you can measure that are associated with the CRS. And so this is one of the typical symptoms or typical side effects of the BiTE attaching T cells to the leukemia cells. There are drugs with which you can treat the CRS if it's severe. You can inhibit this IL-6 receptor with a drug called tocilizumab. And this is something which is quite standard of care. If you have a relevant or severe cytokine release syndrome, you will give this drug. You also will start to give immunosuppressive therapy with dexamethasone. And with this treatment, you usually can treat and reduce the intensity of the CRS. In rare cases, CRS can be really severe and patients can be transferred or need to be transferred to the intensive care unit, and even in some cases they may need a respiratory support. Another typical side effect is neurotoxicity. So in some cases, I would say inflammatory reaction can also happen in the central nervous system. And this can lead to an encephalopathy and in some patients even to seizures. There are some signs that show pre-symptoms of this encephalopathy, which is some ataxia. So you can see this if you let the patients write or paint something. And if this comes up, neurotoxicity, then this would also be a reason to start immunosuppression. So this is the second important side effect. But I have to say that in our trials in children with leukemia, CRS and neurotoxicity was not very frequent, and it was actually not a clinical problem in our trials. There are other side effects which are probably, or at least in part, also related to the pre-treatment, because all these patients have been pre-treated with toxic chemotherapy, and they have like damaged organs, and they have some hepatotoxicity and renal toxicity, so blinatumomab may have some effect on this, but I would say this is a minor point, and we would relate that more to the other drugs than to blinatumomab. In some patients, there's also something like a persistent inflammatory reaction, which is an HLH-like situation, which causes cytopenia, so which happens in the bone marrow. And sometimes you can see in the bone marrow also this kind of HLH-like cells and prolonged cytopenia. And this can be triggered by the immunotherapy effect of blinatumomab. These are the most relevant features. There's also mentioned, if you speak about safety of blinatumomab, the handling of the device, because patients have central lines and they have a pump and they have a continuous infusion of blina for 4 weeks. And sometimes there are just medication errors because of handling with these devices. So this is a logistic problem, which is also mentioned if you speak about the safety of the drug.